Hello, everyone. Welcome to day 2 of the Preemie Health Talks. I'm Fabiana Bacchini, Executive Director of the Canadian Premature Babies Foundation, CPBF, and your host for this event. The Preemie Health Talks is the first international live series that CPBF is hosting in 2021. These educational sessions are in collaboration with the Family Integrated Care Committee, the Canadian Association of Neonatal Nurses, the Canadian Neonatal Network, the European Foundation for the Care of Newborn Infants, EFCNI, and GLANS, the Global Alliance for Newborn Care. For those not familiar with CPBF, we are a charitable organization, and our mission is to empower families of premature babies every step of the way through support and education. We believe that through consistent information, access to helpful resources, and peer support inside and outside the NICU, we can empower families, ensuring they are ready to care for their babies. For these Preemie Health Talks, we brought health experts from around the world and from all over Canada. We'll be diving into topics affecting preemie health, from breastfeeding to parental mental health during the pandemic, from the importance of kangaroo care to the best practices to protect your baby's skin. If you need closed captioning, you can watch it live from our YouTube channel and enable closed captioning on the screen. And I want to thank our sponsors, Medela, Water Wipes, and Prolacta Bioscience. And please use the comment area below your screen to ask questions, to share your perspective and stories. Today, you're going to have 2 sessions. The first one with Dr. Sharon Unger, and the second one with the breastfeeding team from the Sick Children Hospital. And we're going to start here right now with talking about human milk and COVID-19 implications for the NICU and the milk bank. The current pandemic has had a profound effect on medicine, including the NICU. This talk will focus on the provision of human milk for vulnerable, hospitalized infants with a focus on parents' milk first. Human milk banks are also vulnerable during a pandemic, and evidence for the safety and the importance of donor milk will be presented. I have here joined me from Toronto, Dr. Sharon Unger, who comes from the East Coast, where she completed her training before moving to Toronto. She's a neonatologist at Sinai Health, a professor at the University of Toronto, and the medical director for the Rogers Hickson Ontario Human Milk Bank. She's a primary investigator for the Maximizing Mother's Milk program of human milk research. And in 2020, she was awarded new funding from the Canadian Institute of Health Research to study the impact of SARS-CoV-2 on human milk. Dr. Unger, thank you so much for joining us here today. What a pleasure to have you.
It is my great pleasure. Thank you so much for the invitation. I'm so happy to be here. Shall I start to share my screen?
Absolutely. And for all of you watching us on Facebook or YouTube, please send your comments and questions. Dr. Unger will address them at the end of her presentation. And here you go. Now you can go on a full screen.
Okay.
Perfect.
So the objective for my talk today is to discuss the impact of previous pandemics on human milk banking, and to just walk you through a little bit about the processes that we employ in the milk bank, and to tell you what quality assurance practices we put into place at the beginning of this current pandemic, along with some advice for human milk feeding during the pandemic and our ongoing research program. I want to start by saying that human donor milk banking is nothing new. It began in 1909, and these are photographs from Montreal published in the Canadian Nurse in 1939. And you can see in the top left-hand corner, hydraulic pumps were used for expressing breast milk, and then the milk was stored on dry ice. That was the method of freezing it. And in the bottom table, you can see that a lot of milk was processed in Montreal in the 3 years prior to this publication. 204 gallons of donor milk were distributed free of charge, primarily to preterm infants in hospital. So milk banking was pretty prevalent throughout North America and in Canada until in 1985, the Canadian Pediatric Society issued a statement about human milk banking, supporting it and talking about the procedures and the guidelines for milk banking. And then sadly, it was that same year that it became apparent that HIV could be spread through human milk. A full decade later, in 1995, the Los Angeles Times actually quoted the Canadian Pediatric Society, who by this point in time had changed their advice. The title that the LA Times published was "Human Milk Banks Come Back, but Questions Remain." Many shut down after AIDS became prevalent. They even quoted the doctor from the Canadian Pediatric Society who said that when we added the possible benefits and the possible shortcomings, we felt, at least in 1995 in Canada, we would not recommend the use of human donor milk. At that point, there were 23 Canadian human milk banks in Canada, and all but one, the one that is in British Columbia, closed. Donor milk banking then took some time to come back. Donor milk banking in North America, the not-for-profit milk banks, have guidelines that are issued by the Human Milk Banking Association of North America. And you can see that this is a graph of all donor milk that these milk banks put out throughout the United States and Canada. And around the year 2000, there was about 500,000 ounces of donor milk distributed annually. By about 2010, with the recognition of the really significant role that human milk has, particularly in the neonatal intensive care unit, in protecting the health of preterm infants, donor milk banking has really grown exponentially over the last decade. In 2019, there were 7.5 million ounces of donor milk distributed in that year. And then in 2020, the year that the pandemic began, there was not growth, but at least donor milk banking didn't decrease in that year. The New York Times then published another article at the outset of the pandemic in April 2020, asking questions not about donor milk this time, but about whether you should breastfeed your infant if you currently are infected with the coronavirus. And they recommended caution in doing so. In fact, they quoted the American Academy of Pediatrics saying that you should be temporarily separated from your baby during a time of infection. The World Health Organization issued a little bit different advice. They said women with COVID-19 can breastfeed if they wish to do so. And I would argue that can breastfeed was not really supportive information, but that was what they stated at the beginning of the pandemic. The formula companies at the same time were a little bit aggressive, I would say, in their advertising, in that they noted for parents who were worried about infections that their products were immune boosting by including such molecules as lactoferrin or human milk oligosaccharides. They even suggested that babies or children should receive formula perhaps up until the age of 3 years in order to receive these immune boosting factors. Right at the beginning of the pandemic, you may already be aware that there was a lot of hoarding that went on, and in particular, formula was hoarded. And this is an advertisement from a food bank where the formula went on sale because there were so many families without formula to purchase. So just to take you back to the milk bank, I'm the medical director for the milk bank that is in Toronto. There are 4 milk banks in Canada, and we all do employ very similar processes. In Canada, human milk banking is regulated as a food. So we are under the auspices of Health Canada and Canada's Food Inspection Agency. And then locally in Toronto, we do have quarterly surprise inspections from Toronto Public Health. In the United States, they have a very similar process where they're regulated by the FDA. There is a lot of screening and a lot of safeties in place at the milk bank. First of all, when a potential donor presents to become a milk donor, she is interviewed by trained staff, and the interview includes questions about the donor's health, her infant's health, her lifestyle, diet, medications, about how the milk was expressed, collected, and stored. The milk donor must provide her consent. She must undergo testing for all the typical viruses that we worry about transmitting through a human fluid, including hepatitis and HIV. Both the donor's physician and her infant's physician must approve of the donation. And there are many, many exclusions to donating milk. I've listed our website there, which is milkbankontario.ca. And for anyone who's considering becoming a milk donor, I would recommend checking out our exclusions because they are fairly extensive. At the outset of the pandemic, we did add an exclusion for anyone who was sick. And this includes if the donor was ill or if there were any household contacts who would become ill. Recall that at the beginning of the pandemic, it was difficult to have a COVID-19 test. And so anyone who was not able to be tested was considered positive and only negative if they had a lab confirmation that they were negative. For anyone who was therefore symptomatic or tested positive, we deferred collecting any milk from that person for 48 hours prior to the onset of their illness and for the following 10 days. I just want to show you a little bit about how the milk bank operates. It is a closed, locked unit, so all of the screening for the donors is done virtually. Once a donor is approved, she is asked to collect a minimum of 5 liters of milk and then asked to courier her milk to the milk bank. And we do provide a contactless courier. When the milk arrives, these are our diet technicians photographed here prior to the pandemic, so without masks, and they receive the milk and it is all barcoded so that we have excellent trace and recall capabilities. The milk is then put into a walk-in freezer where it is continuously monitored. When milk is going to be used to create a batch of donor milk, it is thawed overnight in a fridge. You can see that we have milk from 4 different donors here because we always blend milk because each person makes a different milk, and this way we blend for the various constituents. This is the processing room in the milk bank. And what you see here are large beakers where we blend 18 liters of donor milk. It's homogenized on a stir plate. We have a dispensing gun where we fill 144 bottles for a single batch, and then each bottle is heat sealed. This is the milk being stirred and then dispensed into a bottle. This is the automated pasteurizer. All of the milk undergoes a heat pasteurization to ensure its safety. Once it comes out of the pasteurizer, the bottles are dried and labeled and they go into a freezer and they're held in quarantine here while we select one random sample and we send it to the lab where it is cultured. And only once we know that it is absolutely negative for everything is the milk released to be dispensed. The milk then goes into a separate walk-in freezer, and from here we ship milk all over Ontario. Now I want to turn to a little bit of our research in COVID. First, a few of the terms that I will use. As I'm sure you're aware, SARS-CoV-2 is the name of the virus, whereas COVID-19 is the name of the illness. This is a picture of the virus itself, and it has on it spike proteins, hence the crown. These spike proteins are what antibodies can attach to. And if antibodies attach to the spike proteins, then the virus can no longer attach to the ACE2 receptors and enter the human cell. So the first thing that we did at the start of the pandemic was look to see whether our pasteurization processes that we already had in place would kill the virus. This is Mike Pitino. He's a PhD student who is working in the milk bank. So he looked at all of the papers on pasteurization. These are papers where milk was pasteurized. And what you can see is that all of the viruses that we knew of before the current pandemic were completely inactivated by pasteurization, except for parvovirus. This includes both hepatitis and HIV. Coronavirus had not been studied in milk. It had been studied in other different types of matrices. So MERS, for example, the Middle Eastern Respiratory Syndrome virus, had been studied in bovine, camel, and sheep milk and pasteurized. And SARS-CoV-1, the coronavirus that we had in Toronto 18 years ago, had been studied in plasma and had been pasteurized. SARS-CoV-2 had been pasteurized in a lab-made medium. All of these cases of pasteurization resulted in inactivation of the virus. So we were pretty reassured that even if there was an asymptomatic donor, pasteurization would always kill coronavirus. But we wanted to continue on and double check. I have to stop and say that this is a photograph of one of our preemies from the NICU at Mount Sinai with her Viking warrior helmet on. So back to SARS-CoV-2. What we did was we took 10 samples of donor milk from the milk bank, and we took them up to the University of Toronto, where there's a containment lab. And in those 10 milk samples, we spiked them with the SARS-CoV-2 virus. And then we took each sample and we divided it in two. Half of it we left at room temperature, just sitting on the countertop, and half of it we put into the pasteurizer. And these are the results. You can see the samples labeled A through J, which is each of the donor milk samples. And what you can see is that the dose started at 1 × 10⁻¹⁰ of virus, and there was about 100-fold reduction in the amount of virus in the milk that was just left sitting on the countertop for half an hour. So interestingly, human milk begins to attack and kill the virus even without being pasteurized. Once the milk was pasteurized, the virus was completely killed. Looking at a little bit of the other literature about whether the virus can get into human milk at all, this is a large study from the United States. Initially, they reported on 18 mothers who had COVID-19 and who donated 37 milk samples. They have continued to collect samples from other mothers and now have hundreds of mothers contributing thousands of samples, and I expect this to be published in the near future. What they saw was that they tested all of the samples for PCR, looking at the genetic material of the virus. They did not find virus in any of the milk samples. But interestingly, they asked the women to swab their breasts before and after washing in order to look for the virus. They did find some evidence of the genetic material from the virus on women's breast before washing. But if the woman washed with just simple soap and water, no virus remained. Also, very importantly, they tested all of the milk samples for antibodies. The antibody in human milk is primarily called IgA. This is a secretory type of immunoglobulin that is very prevalent in human milk. IgG is the typical type of antibody that you find in blood after you've been vaccinated or after you've been exposed to the virus. They found that 76% of their samples had IgA and 80% of the samples had IgG. They then went on to look at whether those milk samples could actually kill the virus, and 62% of their samples killed SARS-CoV-2, or else in medical terms, they neutralized the virus. This is a publication that came from Israel, where they were very early at getting their population vaccinated. And in the black line, you see the antibody response IgA, and in the orange line, you see the IgG levels in milk samples of women who had been vaccinated. And what you can see is that the IgA begins to appear in the woman's milk approximately 2 weeks after the vaccine. At 3 weeks, she received the second dose, and by 4 weeks, there was a peak level of antibody in her milk. The IgG was more prevalent after the second dose of the vaccine. So this led to another publication in the New York Times where they suggested that women were beginning to even relactate after being vaccinated in order to provide antibody protection to their child, or there's more milk sharing going on. Just one quick word about the current advice in Canada. This is the information on Health Canada's website, and they do recommend continuing to breastfeed throughout an infection with COVID-19. There are extra advisories about washing the nursing pillow, about sterilizing the breast pump, and about not sharing any bottles or breast pump with other people. The Canadian Pediatric Society also has a very supportive message on their website, and they do include the information that if you are ill, particularly if you are coughing, to wash your breast prior to putting the baby on the breast. And one message about our ongoing research is that we are also collecting milk samples from people who have COVID-19 or have recovered from COVID-19, from those who are donating to the milk bank, and from those who are being vaccinated. You can see on the top right-hand corner is our Instagram page where we are recruiting people. Particularly, we've had a number of milk samples collected after the Pfizer vaccine, but we are still recruiting for people who are receiving either the AstraZeneca vaccine or the Moderna vaccine. A couple of quick acknowledgements. The studies that in Toronto took place in the O'Connor lab and the Gray Owen lab. We had donations personally from Erica O'Bourne and a grant from the Canadian Institute for Health Research, and a message of thanks from the Rogers-Hickson Ontario Human Milk Bank. And I'll just close there and take questions.
That's wonderful. Thank you so much for sharing this presentation. Okay, there we go. You're good to go. So thank you so much for sharing all your research and your hard work during the pandemic. It's amazing how much we've learned over the last year. Because I remember I had this chat earlier in April last year, and there was so many and how far we've gone in just a year. So congratulations to you and your amazing team.
Oh, thank you.
So I want to thank all our audience. We have people from joining us from Zimbabwe, Mexico, Barrie, Edmonton. So you have people from everywhere. And I'm going to start with one question here. Let me go back to the chat. From Francis, how safe is human donor milk apart from HIV and COVID-19 concerns? Remember, we still have other STIs like syphilis.
Oh, thank you for the question. Yes, I focused primarily on HIV and COVID-19 because those are the pandemics and the implications of those. But absolutely important to not forget about all of the other infections. And so we do screen every donor for syphilis amongst a whole host of other infections. And we do have a number of exclusions as well. We look at diet, medication, travel. So I do believe that it is extraordinarily safe, first because of such detailed screening, and secondly, because of the pasteurization process.
So we have another question here from Nadine. Do you have any comments on freeze-dried milk for later use?
I'm not sure if that's with respect to personal use or milk banks. We don't use freeze drying in our milk bank because it's difficult to courier any milk that's been freeze dried. So I think that the easiest process in Canada is just to put the milk into a deep freezer. The milk has an expiry date of 6 months in the deep freeze. So I just think that's simplest.
Okay, so we have a lot of thank yous here. So I think my next question, you mentioned the guidelines for parents to continue to breastfeed even if they are positive. So what is happening in the NICUs now? If a parent is positive, how can they provide breast milk?
I think that's a really important point, and particularly now, we have long recognized how protective human milk is, and is of particular importance for preterm babies, particularly in protecting them against infections, particularly protecting their bowels against necrotizing enterocolitis. So we knew that. But now, additionally, we know that if a woman has COVID-19, she has antibodies in her milk and is therefore presumably protecting her infant against COVID-19 by supplying her milk. So women who are infected are not allowed to visit the NICU for the 10-day period where they are infectious. And so we always need to figure out a courier system. Hopefully there's a family member or friend who is not infectious who could bring the milk to the front door of the hospital, and then it can be portered up to the NICU, or if not, to arrange a proper courier. I think it is extraordinarily important for us to continue to have that mother's milk brought into the NICU.
Okay, so we have another question here. For infants born term, less than 2 kilos, can you comment on length of time ideally that this infant should receive donor milk? For example, to a particular weight target or a certain time period. Thank you so much.
That's a great question as well, and I think that we need some more research. Right now, what has been studied is that we know that donor milk in particular protects infants against this necrotizing enterocolitis, which is a severe bowel condition that preterm and particularly growth-restricted children are prone to. And so it's important for them to receive always their parents' own milk first. But if there's an insufficient volume of the parent's own milk, to then receive donor milk to cover the period where they're at highest risk of necrotizing enterocolitis. And so that probably covers the period until they are 36 weeks corrected gestational age, or to the weight that they would, if they were typically grown infant, to the weight that they would be at that gestation, so around 2 kilograms, in order to cover that. There has been previously concern that children fed donor milk will not grow as well as if they're fed their parents' own milk. And it is true that some of the enzymes that are in donor milk that are important for the infant's growth and for their fat absorption are not as present as is in raw mother's own milk. But I think that it is incredibly important to follow the growth of all preterm infants, particularly growth-restricted infants, and particularly those who are receiving donor milk, so that they can receive proper fortification, supplementation in order to follow their growth while also receiving the benefits of a human milk diet. So it's there's multiple points in following growth and protecting health and protecting the children against necrotizing enterocolitis.
So the donor milk can still be fortified in the NICU?
Yes, absolutely. Donor milk is fortified very similarly to mother's own milk, but very important to follow the growth. In our own studies in Toronto, we saw that babies who were fed donor milk grew equivalently, but we were pretty obsessive compulsive about following their growth on many times a week basis.
So one more question here from Sarah. Have you noticed any change in baby's response to frozen milk? My son seems to have more oral secretions and phlegm when you try to feed him frozen milk from when he was in the NICU. He has no issues at all with fresh milk. Great question. Thank you.
That's another good question. Part of that might depend on how the baby is being fed, and will be a good question for the next section too. Whether you're bottle feeding and the type of nipple and so on. Frozen milk is different from fresh milk. Fresh milk has more living cells in it. And so babies will behave differently to it. Some of the fats can also change once they're frozen, and it can just taste different. Something that's frozen can taste different. So they can behave differently to it, for sure.
Okay, so more questions about the vaccines. Vaccines and breast milk. Can moms who are breastfeeding get the vaccine?
I'm so glad that question was asked. Yes, yes, yes. Please get the vaccine, and do not defer breastfeeding for any moment after being vaccinated. There will begin to be antibodies in the milk very quickly. So very important protection for the baby. There is nothing harmful that will appear in the milk. So we have the guidelines are on our milk bank's website, but they're available on many websites. Any of the 4 vaccines that are licensed in Canada, the Johnson & Johnson, AstraZeneca, Pfizer, Moderna, there's no deferral period for providing your milk after vaccination.
Okay, thank you. In terms of research, you mentioned a little bit of what's happening in research. What is the latest research?
I think, the research is really that it's very safe to provide milk during a time of COVID-19 infection, but probably important to wash your breast, but put the baby on the breast, or for the baby who's in the intensive care unit, pump milk and send milk, and that there are really important antibodies in the milk. What's really interesting to me, and I think the direction our research is going to go, is how is human milk killing COVID-19, the SARS-CoV-2 virus? Even in women who haven't been vaccinated, the milk begins to kill the virus. So I think there are a whole host of interesting cells, complement, antibodies, all kinds of things in human milk that kill virus even before a woman is vaccinated. So I think we're going to be going into the lab a lot more and looking at all of those components of human milk that just get to work and start killing the virus.
Oh, it's fascinating. It's fascinating.
It's cool.
What breast milk can do. Amazing.
I hope to be invited back in one more year, Fabiana, so I can talk about all those components.
So for people who still want to donate during the pandemic, so what is the protocols? How they can initiate that process?
Yes, please do go on to our website, or in other parts of the country, go on to the milk bank that is closest to your home and find out all the guidance for how to donate your milk. There's outlines about exclusions for donating and all of the necessary steps to become a donor. And you can submit an intake form directly through the website, and we will contact you back to go through the process over the telephone. The processes are all done virtually right now, but it does require going into a lab to have the blood work done. Once you're approved as a milk donor, then we send the courier to you, and it's entirely contactless pickup.
Oh, that is so great. So how are the volumes of the milk banks? Because I remember asking a year ago, were you afraid that the volumes were going to drop because of COVID? So what happened during this year?
I was pretty worried at first, and I was happy to get the message out about the importance of milk banking at the outset of the pandemic, particularly as we saw what has happened previously. But actually, our milk volumes have remained very, very steady. Our inventory has been good. Now, mind you, we do distribute 150 to 180 liters of donor milk every week. So we are in constant need of new donor mothers, as are all of the other milk banks. So, please do consider making a donation. But those who are donating, it seems to be while people are at home with their older children in homeschool, they're able to pump an awful lot of milk. So we do have donors making some pretty giant donations. It's pretty amazing. So we've been able to keep up our supply there's been a steady demand, and we've been able to keep up our supply.
And it's so great. If you follow the Milk Bank Ontario on Instagram, you can see when they get a donation with a big volume of milk. It's pretty amazing to see all those bags coming, and fascinating. So
well, you're a lot more tech savvy than me, but I think the audience is probably also much younger than me. So please do follow us on Instagram.
Yes, I guess so. We need to go on TikTok to get an even younger audience.
Okay.
Sunset, Facebook, and Instagram is for older people. It's okay, get it. So how is we only have 4 banks in Canada. How is the milk distributed across the country?
It's all by courier. Everything is shipped by frozen overnight courier. So Ontario supplies milk to all of Ontario and Newfoundland, and Calgary supplies pretty much everywhere else, with the exception of there is a milk bank for Quebec, and there is a milk bank for British Columbia, and the remainder comes from Calgary. So it's just frozen overnight shipments coming into the milk bank and then going back out.
Only parents of premature babies can access milk banks in Canada, or term babies as well?
Well, you ask a very pointed question. So we do triage milk first to babies that are inpatients in hospital, because that's where the evidence shows the greatest benefit. Some of the milk banks have excess milk and are able to supply to outpatients. We are hopeful that in Ontario, we haven't really started yet, but we are hopeful that as our supply remains steady, that we will be able to launch such a program. I'm also hoping to be able to open that up as a new area of research, because really the literature right now is for preterm infants. The late preterm infant and the term infant have not been studied. So, it's beginning, but we really don't yet have the science to back up the recommendations.
Okay, so Dr., any final thoughts to share with our audience of parents and healthcare professionals?
I think, as we said, the human milk is super, super interesting, and I'm so pleased to see that it's being supported and promoted throughout the pandemic, and its value is being recognized during the pandemic. So, please stay in touch. Send me an email if you have a question, contact the milk bank, follow us on Instagram, because I'd be very interested to keep in touch.
Okay, Dr. Unger, thank you so much for joining us here today. Always a pleasure talking to you and see what is the latest in research and your work. Thank you.
It is for me to say thank you to you.
Thank you. Oh, and for all of you watching us from YouTube or Facebook, thank you so much for joining us. We will continue this conversation on breast milk with the breastfeeding team from Sick Kids Hospital in just a few minutes. And I want to thank our sponsors, Medela, Water Wipes, and Prolacta Bioscience for their ongoing support. And CPBF is a charity, and 100% of all donations received this week will go to our support programs for families. To donate, you can go to canadianpremies.org. Right here is our website. And stay tuned, and we'll be back in just a few minutes. Thank you.